From KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. Back in 1948, the U.S. and other countries created a unique coalition. The World Health Organization addressed global health challenges, including disease outbreaks like COVID-19. At the start of this year, the Trump administration formally withdrew the U.S. from the WHO. That withdrawal creates uncertainty over how the U.S. and individual states like Colorado will track and respond to future outbreaks. So, Colorado health officials are trying a new tactic. They've applied to join the WHO's Global Outbreak Alert and Response Network, or GOARN, as an individual state. Scientists and health officials say the move will put Colorado in a better position to respond to emerging diseases and will foster stronger public health policies across the state. Health reporter John Ingold of the Colorado Sun has been following this story. He joined me to talk about the decision to join this global health network and how it might help Coloradans prepare for the next health crisis.
So Colorado does sometimes see things a little bit earlier than the rest of the country when we're talking about these like new viruses. And one of the reasons is because of our ski resorts, right? So people come from all across the world to ski in Colorado. That creates a lot of people coming into, again, through DIA and bringing potentially new viruses into the state of Colorado. So really what this network is about is it's about creating sort of awareness and lead time. It helps local public health officials know, okay, here's what's spreading, here's where it's spreading, we're seeing potentially it moving through international travel. And then that gives you a chance to kind of prepare with, what do we need to know for testing? What are the symptoms? How do we tell our hospitals and our doctors' offices, hey, be on the lookout for these kinds of things as they come in? Mm-hmm. They may share also like treatment advice, ideas on how to treat the disease. They could share advice on particular populations that are most at risk. They could share disease sort of containment plans. Mm-hmm. But really, it's about just sort of the awareness of what's happening and when it becomes enough of an issue that we need to be thinking, hey, this could actually be coming to Colorado.
We should point out, too, that the WHO's guidance during the pandemic was a big part of the Trump administration's decision to withdraw from that organization, right?
Yes, absolutely. Yeah, the Trump administration feels like the WHO provided unreliable information during the pandemic, didn't respond appropriately. And so that contributed to their argument for why the U.S. should pull back.
John, it's interesting to me that federal health agencies like the CDC or Health and Human Services once were highly respected sources of health information. How are your sources talking differently about the CDC in the past few months?
Well, I think this is really the big picture takeaway from this story. It's not just that Colorado is going to be joining this network, which on a practical level it's a conference call once a week. Mm-hmm. You kind of dial in, you hear about what's going on around the world, you kind of absorb that information. From my understanding, it's really not a huge lift in terms of workload for Colorado, but it does sort of highlight the way in which Colorado and other states, especially those who are being led by Democrats, are trying to build out these like alternate public health systems or these alternate connections to things that used to be handled by the CDC. So for this story, I talked with the state epidemiologist, Dr. Rachel Herlihy. She's the deputy chief medical officer of the Colorado Health Department. And she mentioned that in the past, if they wanted to provide information about a specific disease, for instance, they would have linked to a CDC website. Mm. And that was, as far as it would go for Colorado's work on, creating that information. But now the CDC may not have guidance that Colorado feels like is scientifically appropriate or feels like is the best advice that could be given. And so Colorado is thinking about what other sort of sources of information can we be linking to? What other ways can we be getting out information? You saw this when the pediatric immunization schedule was changed. Mm. And the Trump administration reduced the number of diseases and the number of shots that were going to be given under that immunization schedule. Colorado responded by putting out its own statement and saying, hey, we think people should follow the immunization schedule as created by the American Academy of Pediatrics, a sort of professional association, which continues to recommend more or less the old schedule of more diseases, more shots.
Well, you mentioned that the GORN network is kind of like an information sharing conference call once a week. Let's say we have another disease outbreak. How would Colorado's membership in GORN help shape the state's response?
Yeah, so I think a great example would be something like the Mpox virus outbreaks that we saw in Colorado a couple years ago.
Yeah.
Mpox is the virus formerly known as monkeypox.
Mhm.
It was being spread through international travel. And so Colorado kind of knew that this was potentially going to land here and could look at, again, testing capacity. There's a vaccine. So what's the vaccine supplies that are available? What are the appropriate disease response strategies? What sort of information do we need to provide to doctors? Because it's not something we see here in Colorado. And so it's just having that awareness of what's happening and then knowing, okay, this is becoming a bigger thing. We need to kind of get on top of this and get answers to all those questions so we can be ready when a case lands in Colorado.
Well, Colorado has applied for membership in the global network. How soon will a decision be made?
My understanding is it shouldn't take too long.
Mhm.
Other states have already applied, including, I think, Illinois, I believe California, and it's just a formality to go ahead and get approved.
And do public health officials perhaps consider joining this global network part of the process of rebuilding some trust in public health here in Colorado?
I think their response would be that this is about providing the best information they can, both to their own staff to do their work and also to the public.
Mm.
Public trust is a difficult thing because it depends on who the member of the public is that's doing the trusting. And so you could conceive that there are people who are concerned about what's happening with federal health policy, who are concerned about the CDC, who would say, okay, I feel a lot better now about what Colorado's doing. They're citing reliable sources. I know I can go to the state health department and they're going to send me to maybe even a place I didn't know exists. And I didn't know that the GORN existed before Colorado applied to join it. So people might feel like, hey, I'm feeling a lot better about this. There will be another subset of the population, of course, that agrees with what's happening with the CDC and likes what the Trump administration is doing.
Sure.
And potentially this creates now distrust about what Colorado is doing. Even if you're looking at this as like a well-meaning, well-intended, just want to get the best information from the best resources possible kind of approach, it's really difficult to stay out of the polarization field these days.
John Ingold covers health and health policy for the Colorado Sun. We'll include a link to his reporting on Colorado's decision to join the Global Outbreak Alert and Response Network in our show notes and at KUNC.org. That's it today for In The NoCo. I'm Erin O'Toole. Thanks so much for listening.